Good morning. Thank you for being with us today. My name is State Representative Chris Taylor. I represent the central part of the city of Madison, and I'm the ranking Assembly Democrat on the Joint Finance Committee. Thank you so much for being with us today. We have so many incredible advocates, and I want to just briefly introduce some of my colleagues from the state legislature. We have with us today Danny Reamer, Chris Sinicki, Greta Neubauer, Joe Castas-Amaripa, you'll hear from her later, Todd Onstead, David Crawley, David Bowen, and some of our newly elected, Kaylin Hayward, and of course Robin Vining, and so many other local electeds here. So thank you all for joining us. In my 8 years in the legislature, I have watched Republican politicians on issue after issue ignore the priorities and the will of the people in our state. The Budget Committee just finished up a month of public hearings on the people's budget, which is Governor Evers' proposed budget. Thousands of Wisconsinites attended these hearings, and the overwhelming majority implored us to adopt this budget. These weren't handpicked people, they weren't invited guests, these were members of our state, these were ordinary citizens who came out to have their voices heard and to participate in our democracy. And they overwhelmingly support the people's budget because after 8 long years of their voices being ignored, they are ready to have a budget that invests in them, their families, and their communities. Yet once again, late yesterday, the Republican co-chairs of the Joint Finance Committee announced that their very first budget motion, which is scheduled to take place next Thursday, is going to remove some of the most popular items in the people's budget, including full Medicaid expansion, which was one of the top items people came out to our budget hearings in support of. Republican politicians, once again, are not listening to the people of this state. They have their fingers in their ears. Who could be against covering 82,000 Wisconsinites with Medicaid health care, drawing in $1.6 billion federal dollars? Let me say that again. Attracting to our state $1.6 billion federal dollars and saving over $324 million state dollars. We have the opportunity to cover more people with needed vital health care that's going to save their lives while saving state money and attracted very needed federal funds. Now, who could be against that? Certainly not the people of this state. As we know in a recent Marquette poll, 70% of the people of this state support Medicaid expansion. The majority of states have accepted this money, and I'm talking about red states, blue states, purple states. The majority of states have opted to invest in their people and expand Medicaid. So who could be against this, you ask? Well, the Republican leader in the Assembly, Robin Vos, is leading this misguided effort. On Twitter, in response to a recent article that Republican senators may be open to MA expansion, Rep. Vos responded on Twitter, #never. He has publicly commented that he doesn't care if people support Medicaid expansion. He has said he has to do what he thinks is right. This is an arrogant, outrageous, egregious response to the people of this state, and it is a slap in the face to the people of this state. Make no mistake, there's nothing right about refusing to provide health care to low-income people who are in desperate need of it. These people who don't have health care coverage now, their lives could be saved, and Representative Vos and his Republican colleagues are turning their backs on them. There is nothing right in refusing to cover more people, in attracting needed money, and in saving many millions of dollars of state funds that is reinvested in the people's budget, in expanding health care, in really needed areas that will touch every single part of this state. So for instance, the People's Budget invests the state savings in more substance abuse and behavioral and mental health supports, in healthy mothers and healthy babies to improve maternal and infant health, in lead remediation for kids who are lead poisoned, youth tobacco use prevention, increasing caregiver wages, which we heard a lot about, dementia care specialists for our seniors, among many other things. It's not too late to change course. This budget motion to remove MA expansion will be taken up, as I said, next Thursday in the Joint Finance Committee. To the people of this state, we need you to send and continue to send a very strong message that MA expansion must stay in the next budget. Literally, the health and lives of Wisconsinites around this state depend on it. The days of Republican legislators putting politics over the people of this state must end. And next, I'd like to introduce to you Representative Evan Goyke, who also serves on the Joint Finance Committee. Thank you.
Thank you. Good morning. Thank you all for being here, and thank you, Representative Taylor, for the introduction. I'm a representative here in the city of Milwaukee, and I'm proud to support the People's Budget, and I'm proud to support the expansion, full expansion of Medicaid, and I'm doing that, and I'm proud to support this policy for my constituents, because normal, everyday people will benefit through expanded coverage and quality of health care. But I want to talk a little bit to all of you about the benefits outside of my community, because this isn't a policy that only benefits the city of Milwaukee. It benefits every single corner of the state of Wisconsin. Under the governor's proposal, $81 million will be invested in health care in Waukesha County. $100 million will be invested in health care in Racine County. And as I've mentioned, substantial amounts in Milwaukee as well. We know where Senator Alberta Darling stands on this, but I have many questions for my other Republican colleagues in this area. I want to know where Joe Sanfilippo, Rob Hutton, Jim Ott stand. I want to know where Senator Dale Coinga, Dave Craig stand on this issue. I want to know what they will tell their constituents in Waukesha County about why they will be rejecting $81 million in investment in their home county. What are they going to say to this region? The Milwaukee region, the M7 counties, will receive over $1 billion in health care investment under this proposal. We need that type of investment for our economy and, of course, for people's quality of life. This is the people's budget. It's not Robin Voss's budget, and I want to hear what my Republican colleagues have to say about it. And so my ask to all of you as you cover this is to call those legislators and get them on the record of whether or not they support full Medicaid expansion. And to the constituents in those districts that are listening or watching, I want them to call in to their state elected officials and find out on the record a yes or a no where they stand on full Medicaid expansion. As Representative Taylor said, this is about returning federal tax dollars back to the state of Wisconsin. Republicans should support this. They pay federal taxes just like Democrats do. This is our money, and it's time that it comes home to the state of Wisconsin. As Representative Taylor mentioned, full Medicaid expansion allows additional investments in other parts of our healthcare system. And I want to turn the podium over to my friend and colleague from the south side of Milwaukee who's going to highlight a couple of those areas, State Representative Jocasta Zamarripa.
Good morning. I'm State Representative Jocasta Zamarripa. Representative Taylor mentioned some of the local electeds. I see Mayor Barrett has joined us, as well as many of our aldermen and alderwomen. Milele Cogs is here, Shantia Lewis, Nick Kovac, Alderman Murphy, and I think Jose Perez. Anybody else? Alderman Barkowski, as well as I see County Supervisor Supreme Mora Amakunde in the audience here with us today as well. So thank you for being here. Yesterday, at the end of the day, Republicans announced their gutting of the people's budget. In doing this, Republicans have shown that they do not stand with Wisconsin women. Republicans do not stand with the children of Wisconsin. Republicans do not stand with Wisconsin families. Maya Angelou said, when someone shows you who they are, believe them the first time. Legislative Republicans have thumbed their nose at middle-class families by leaving millions upon millions of dollars on the table for Medicaid expansion, refusing time and time again to bring federal dollars home owed to Wisconsin to increase healthcare access for all Wisconsinites. Still, we know that now is not the time to give up. We must keep fighting, keep advocating, keep working toward what is right and what is just for Wisconsinites. This was not Governor Evers' budget. He went out and obtained insight from the people of Wisconsin. This is the people's budget, and we must continue to shine a light on the issues that matter most to us, to our families, and to our communities. And with that, I want to introduce one of our history makers, the first Black man to hold statewide elected office here in the great state of Wisconsin, Lieutenant Governor Mandela Barnes.
Thank you so much, Representative Zamaripa. Thank you all for being here with us today. It's important as we work to represent the entire state. We have a responsibility and we have a duty, and that responsibility and duty has been lost on Republican leaders in the legislature. It's just because a majority of people decided to not vote for them does not give them the right to ignore that same majority of people in the state of Wisconsin. It's unfortunate that we are where we are. And if there's one thing that Governor Evers and I have learned traveling the state and listening to the voices of thousands of Wisconsinites over the past several months, is that they want us to bring back our money, our federal dollars to expand health care coverage throughout the state of Wisconsin. The irony isn't lost on me that Wisconsin Republicans announced their plan to ignore the will of the people and to deny coverage to some 82,000 more Wisconsinites while they were out in Washington, D.C., hosting an elite fundraiser that costs a minimum of $1,000 to attend. It's unfortunate that Wisconsin Republicans have needlessly put our state in this situation because things can be better for so many people across the state if we were to take this common sense yet critical step in our state budget. We all know that doing so will save the state money, it'll save the average consumer money, and provide more flexibility for the people across our state to be insured. The latest Marquette poll from the last month, as was stated earlier, said that 70% of the people of Wisconsin want us to expand Medicaid. By trying to eliminate our Medicaid expansion, Republicans are turning their back on those same people, along with the over 80,000 people that will be covered. Republicans right now have an opportunity to come to the table and work with the governor and I on a bipartisan solution that's supported by a majority of people in this state. And it's unfortunate that they're choosing politics and division over compromise and bipartisanship. This isn't just a failure for our state budget, it's a moral failure for the entire state of Wisconsinites who deserve access to quality and affordable health care. And so with that being said, you look at the $2.4 billion that the budget would allow us to invest in Medicaid expansion. In Milwaukee County alone, it's $695 million. This happens while taxpayers across the state save $325 million. And we know that we can do better. And it is a shame that we're in this place right now. Speaker Vaught should be ashamed of himself for ignoring the health and safety of the people of the state of Wisconsin. The last administration turned down that money. This isn't Scott Walker reincarnate right now. There's no do-over. We deserve more. And with that being said, I'm proud to introduce to you the governor of the state of Wisconsin, Tony Evers.
Good job. Thank you. We're not giving up. We're not giving up. Wisconsin has a long history of leadership and innovation in advancing quality health care. This budget seeks to build upon those strong fundamentals and a legacy by investing in public health, preventative care, long-term care, and behavioral health for every Wisconsin resident, whether they're Republican or Democrat or any place in between. And it starts by accepting funds to expand Medicaid. Since 2014, Wisconsin has left more than $1.1 billion on the table. That's our money that we paid for because we have refused to accept federal funds to expand Medicaid. And in all honesty, that's absolutely ridiculous. It's your money, folks. And right now, Wisconsin's federal taxpayers' money has been paying for health care in other states. We know that the people want us to change that. They want to see investments in our Healthy Women, Healthy Babies initiatives that would help address racial disparities in birth outcomes and ensure that more moms get the health care that they need. Folks in big cities and rural communities across the state want us to expand access for dental care. They want us to support our caregiving workforce and provide more resources for substance abuse treatment and long-term care. Medicaid expansion is a lever that we will pull so that we can make these investments. The budget would bring $1.6 billion, as has been stated before, in new federal funding to make historic investments in health and well-being of every Wisconsinite. You know, I had an opportunity yesterday to speak to a group of about 500 doctors that were going across the street that day, yesterday, to advocate for Medicaid expansion. I had the honor of having my oldest daughter introduce me, she being an obstetrician, gynecologist in the state of Wisconsin, and it was a special moment. It was a special moment for me personally, but it was also a special moment to have the people, the doctors of our state, getting behind this issue. Who knows more, right? Who knows more? Who knows more than the people that need this expansion? So during the campaign trail, and then at the same time when those doctors are going over to the Capitol, where were the Republican leaders going? Out of town. Those doctors didn't get a chance to talk to Robin Voss, did not get a chance to talk to the leaders of the Joint Finance Committee. So on the campaign trail, I heard over and over about health care. It's one of the most talked about issues during the budget sessions, and it's also one of the most important issues talked about at the Joint Finance Committee at their budget hearings. So I know it's hard to believe, but we have to put political rhetoric behind and make sure that health care is affordable and accessible in the state of Wisconsin. 70% of the folks in the state say yes, and a whole bunch of those are Republicans. So I'm here today with a message for the people of Wisconsin. I'm going to fight like hell for Medicaid expansion. I need your help to get it done. I need you to call your legislators. I need you to call your legislators and tell them that you support Medicaid expansion. And here's a number you can call, 1-800-362-9472, and I'll repeat that, folks. 1-800-362-9472. Call them and tell them that you want to have the Medicaid expansion. Now, we know that getting more Wisconsin residents health care coverage through Medicaid expansion is the key to a stronger health care system for our state. And with your support, we can get this done for the state of Wisconsin. Thank you very much, and I'll be glad to entertain questions at this point in time.
Governor, if lawmakers send you a budget without Medicaid expansion, will you sign it?
I'm sorry, the question again?
If lawmakers send you a budget without Medicaid expansion, will you sign it?
We're not ceding 1 foot on that. You're operating under the, not you personally, but people are operating under the premise that that we can't get Republican support, and that Robin Voss's will is not the will of the people of Wisconsin. I believe we can change this. We're on the first step. We believe that we're going to be able to change this.
Governor Rivers, what will you say when you meet with Foxconn CEO Terry Goh later today?
I'll say hello, Chairman Goh. It's great to see you, and I'm looking forward to making sure that you're successful in the state of Wisconsin. We protect the taxpayers and the environmental standards that we have in the state, so I'm looking forward to that.
Governor, are you going to ask him if the footprint is smaller in Mount Pleasant for the buildings?
Well, I think I can ask them, but I think that's already true. They have moved their efforts instead of a Gen 10 to 6.5, which is clearly a smaller footprint. Now, this is all about healthcare. This isn't about Terry Goh, or it's not about the other parts of the budget. This is about healthcare, so I appreciate the comments around that. Any questions about healthcare?
Regarding Medicaid expansion then, I guess I didn't hear a yes or no on whether you would sign a budget that excluded that. Is that a red line for you? I mean, can you just elaborate a little bit on?
Well, my elaboration is this, is that I believe the people of Wisconsin also support Medicaid expansion. And I believe that with an active group of folks across the state of Wisconsin indicating what their preference is, that this will change. I will never say that we will never veto a budget, but my goal, and I know this will happen, is that the people of Wisconsin will step up, join all these people that are standing behind me, and make sure the change is made. We aren't ceding anything. We're not negotiating against ourselves. We have to have this, and we believe we will get it.
We have time for two more.
I'd add, just because they get to ignore the people of the state of Wisconsin doesn't mean that we are.
That's right.
Great.
Are we aware of any other governors or any other states that are behind the money from federal?
No, I'm not. The red states and blue states and purple states all have decided years ago that they would take this money and invest it in their citizens. It's a shame that we're standing here today saying that the Republican majority of the legislature are working against the will of the people of the state. I believe there is Republican support for this. It's been shown. I've read news accounts where some Republicans are open to that. I encourage the people of Wisconsin to give them a call and verify that.
Governor, do you want to address the other items that the Finance Committee is stripping out of your budget? Some other pretty significant proposals in your tax agenda, your marijuana reform proposals.
Well, again, I'm not ceding any territory on any of those issues, but it's clearly looking at the people that are standing here today that Medicaid expansion is a top priority, and we're not going to cede territory on that. So thank you very much.